Cameron Polam, ABC 15,
has joined the conference.
Good morning, everyone. Welcome to the press conference. I'm Roger Galloway. I'm the Communications Director for Mohave County. I wanted to mention one little important fact about the presence of our participants this morning. All of them are socially distanced properly. We also have plexiglass up above on the dais as well. And they're not wearing face masks also for that very same reason. So all is well on that front, and I just wanted to emphasize it. Our press conference this morning involves primarily our 4 hospital CEOs from Mohave County. We also have our health director, Denise Burley, on board as well. From the Western Arizona Regional Medical Center, we have Mike Stinger, who is the CEO there. He will be on the closest to Denise Burley. Next, we have seated on his left, we have from the Kingman Regional Medical Center, we have the relatively new CEO from there, Will McConnell. We have from Havasu Regional Medical Center, CEO Mike Patterson, who is next. And on the far end, we have from Valley View Medical Center, Feliciano Huron. So they're all here to answer your questions this morning from the press that we have on board. I would say we will start off with opening statements from our participants before turning to the press for their questions. We'll first call on the press by individual outlets. Please identify yourself by name. You may ask a question and have an immediate follow-up as well. After I've called on some individual outlets, any reporters can simply say, I have a question. I'll call on you, just identify yourself, and we'll go ahead from there, and we'll continue. We expect the press conference to last approximately 1 hour. We're going to turn first for an opening statement from our Mohave County Health Director, Denise Burley.
Good morning. Thank you for joining us today to discuss COVID-19 in Mohave County. Cases have been on the rise in Mohave County since late October, with substantial increases in the past 6 weeks. This recent increase has surpassed the summer spike and placed a substantial strain on our healthcare system in our county. To give some perspective, last year there were 53 deaths from influenza and pneumonia. As of yesterday, we had 278 Mohave County residents who have died from COVID. This is not the flu. It is far from the flu. As a matter of fact, if you do your math, that's about 5 times higher than the flu. And I think I am joined today by the CEOs of the hospitals to talk about their situation and their facilities, the conditions, and a little bit about the vaccine, and try to answer some of those questions as well. And thank you very much for participating.
All right, let's start off with an opening statement from Mike Stinger from the Western Arizona Regional Medical Center.
Thanks, Roger. The last time we met, our hospital had a single isolation unit open and operational with 20 beds. A month ago, we opened up a second unit and added 24 more beds for a total capacity of 44. As my colleagues and I live every day, our capacity to treat COVID-positive patients or those that are suspected of having COVID changes hour by hour and shift by shift. Last Friday, at this time, we had 31 patients. Almost half of our hospital inpatient census were in isolation with COVID positive results. Today, that number is 23, which is about a third of our census today, but it changes that much in that quick a period of time. I will say this, up until this week, we've said wash, mask, distance, and stay safe pretty much to everybody that we talk to on every opportunity that we have. We're adding vaccinate to that list as of this week, and we know the vaccine is going to work. We highly recommend that you get the vaccine when you're able to. Thank you.
All right, we go to the opening statement from Kingman Regional Medical Center CEO, Will McConnell.
Thank you. So I want to talk a little bit about the surge and the nature of it. Over this entire period, we have tested 18,000 individuals at KRMC. We've resulted 17,860 of those, and the number of positives is 1,565. The percent positive there is about 9.6%. Our 30-day rolling average is over 24%. So what that indicates is the surge is real, and we are seeing many more COVID positive patients. That has now transitioned into our own staff from a community spread perspective. And essentially this month, we've had 96 staff members contract COVID, 47 in the last week, and about 40% of that bedside support, whether that's nursing or nursing assistants, et cetera. So that is one of the things that has put a little bit of a strain relative to the staffing component. We're still able to fill the need that exists. And as most have said, this is a function of staffing. It's not as much a function of space. We have the space, we have the ventilators. It's the staffing that's an issue. Recently, as early as last week, we started providing the BAM treatment, which is the microbial antibody. Say that 3 times fast. And we have been providing that in an outpatient setting. To date, we believe that we have prevented 9 inpatient stays, which each equate to about a 5 or 6 day length of stay. And so that treatment, Regeneron and the BAM treatment, are things that we're looking at in our community to help prevent those hospitalizations, to allow that space for those that really need the inpatient stay. Census is managed daily, managed hourly, and our staff are doing a phenomenal job from the top to the bottom, from the side to the side. Everyone is pitching in. In fact, just before this, had a staff meeting with the directors and managers to discuss how are we going to pull from some of the outpatient areas to support the inpatient side during this 2-week period where we're feeling the effect of our own staff being ill. Thank you.
Thank you. We'll turn next to a statement from Mike Patterson, who is the CEO of Havasu Regional Medical Center.
Thank you, and good morning. Appreciate the opportunity to participate in this important conversation. So at Havasu Regional Medical Center, our top priority is safe, high-quality care for the communities that we serve. And this has never been more true than it is today, as we all are trying to navigate through what really are uncertain times in our country and certainly in Arizona and in Mohave County. Our COVID cases have risen over the last 6 weeks, as Denise indicated, with the county numbers. We have mirrored those kind of numbers in our hospital, seeing more cases now than we saw back in the summertime. We do look forward to the arrival of our COVID-19 vaccine. We have been diligently preparing over the last couple of weeks to ensure that we are operationally ready to administer the vaccine. We'll start with our frontline employees and then move into other healthcare workers and then go on from there. This vaccine is a major step, as most of you know, in getting us hopefully back to normal. But we also need to be clear and recognize that this isn't going to happen overnight. It is going to take months to get this vaccine distributed and everybody given the opportunity to have it. And so I would just encourage, as others have, that we continue to take all the safety precautions, wear our masks, stay socially distanced, and wash our hands, and just be extra vigilant right now, especially where we have seen these numbers increase so much over the last few weeks. And then I also want to thank our staff, who are working really, really hard. We all are in the same boat as far as trying to get enough staff and keep them healthy so that they can provide the care that we need. So a big thank you to all of the healthcare workers in our county who are doing their best and working very, very hard to take care of our community. Thank you.
Thank you. Finally, from Valley View Medical Center, the CEO there, Feliciano Huron. Yes, sir.
Good morning. Again, we want to thank everyone for the opportunity to speak today in regard to what we are seeing with the COVID pandemic and the spread throughout our community. Our patient safety and the safety of our staff is a top priority for our organization. We are working diligently to ensure that we're handling those patients that are coming through the facility, and also working with our partners out in the community from the Department of Health and our other county sister facilities that are also providing some of the same care to our patients. This is a big influx that is impacting all of us every day, and to the point that everyone sitting here today has made, this is something that is going to continue to challenge us. We are very much looking forward to the arrival of the vaccine in the community. This is going to be a huge difference for us. It's going to be a game changer. But in the meantime, we still have to deal with the pandemic as we see it. We continue to ask folks to be able to wash, mask, make sure that they maintain that social distancing. And when given the opportunity, we're going to ask those people to please vaccinate. This is going to be an opportunity for us to really bend the curve and help our community to get back to a new normal. Again, thanks to our staff, our physicians, and our partners in the community for all the hard work that they're doing as we continue to move forward. Our next big challenge is going to be to make sure that we are proactively reactive to the things that we need to do to make sure our vaccination centers are open and that our staff and others are participating so that we can fulfill that ongoing mission of making our communities healthier. Thank you.
Thank you. Thank all of you. I'm at a small disadvantage here in that I do not know which members of the press are on board with us online right now, but I'll start off with and chime in later if I miss you, please. From the Mohave Daily News, do we have someone? Do we have a reporter or editor on? All right. From Lake Havasu, the Herald.
Michael Dodd here.
Go ahead, Michael, with your question or questions.
I guess with the vaccinations coming out, could you tell me how many are expected in each hospital? And what the process will be for scheduling?
So I can start that conversation, and if you all can add in, that'd be great. Thank you. So Mohave County received 5,700, was allocated, I should say, is the correct term, 5,700 doses of Moderna vaccine this week, and those were shipped and should arrive either today or tomorrow in the respective communities. Basically what happens is facilities onboard through the Arizona Department of Health Services. Through that onboarding process, they're approved based on the facility and their capability of holding the vaccine. And then the county is responsible for allocating that vaccine out to those facilities. So they've indicated to us how many vaccines they would like, how many doses, and then we've allocated that out to them, and they should arrive this week, as early as today and into tomorrow. So as far as... I'm sorry, I didn't hear the question.
Can you tell me how many are coming to Havasu in this first wave?
How many are coming to Lake Havasu City in this first wave?
Do you have that information, Mike?
Yeah, so Havasu Regional has requested 1,000 doses, and so again, until they show up on our doorstep, we don't know exactly, but that's what we have requested. We are going to be starting, as I mentioned, with our direct caregivers in the hospital, EMS, as well, and then expanding from there. But it's going to be focused on healthcare workers over the next 2 to 4 weeks in order to get those out. We are informing people that would be included in those in that first wave of shots, and they are given a number that they can call so that they can schedule their time to come and get their vaccination. We're ready to start this afternoon if we receive the doses, so we'll just see when we get them.
All right, we can come back to you, Michael, in a minute if you like. Let's see, do we have from Radio Central, we have Paul on the line, Lavoie?
Yes, thank you, Roger. Paul, I'd like each CEO and Health Director Burley to tell me if you will take the vaccine as soon as it is offered to you.
I can start. Yes. I do plan to take the vaccine when it is my turn to take the vaccine. I will not be taking it before then.
Same with me.
The same for myself as well, when the opportunity presents and I fall into the appropriate category.
And that's the trick. Same way, it's the appropriate category. I'm not gonna take a vaccine from a frontline worker or from someone who's on those units. I'll wait for my turn.
Absolutely.
May I ask one question, just interject myself? There's and then Paul, you'll still get your follow-up. If we discover that the amount that's allocated to the first group, you're going to have a number of them left over, do you immediately move over to the next group?
No, we do not. So we're following ADHS's guidance on this, and ADHS is determining the cadence of this operation and how we move through these phases. So we will be communicating where we believe we are in a stage with ADHS regularly, so they understand and they recognize the fact that each county is going to move at their own pace based on their population, the numbers, et cetera. So they're listening to us, and then they'll be making those decisions based on that. But the goal is for us to be moving somewhat fluidly through this as a state, and that will also prevent people moving and traveling to different counties to move ahead in that to another phase. So if, for example, we were to move on to phase 1B before another county that's, especially one that bordered us, somebody else might move over to our county and pull from our allocation to get vaccinated.
All right, thank you. Yes, Paul, you have a follow-up?
No, but there is a really bad delay on the phone to where it's coming back to me about a half second later. Very annoying.
Sorry about that. I don't know if our IT department heard that or not. Hopefully they did. All right.
Thanks, Roger.
You bet. I have a series of questions from the Kingman Daily Miner that were submitted to me. Before I go to those, would someone like to chime in that we have on board right now with a question and a follow-up? Go ahead if you'd like to. Oh, I've got a text. I'm getting a lot of text. Okay. Let me take this. I'm getting some of these from okay. This is just a minute. Okay, this is for Will McConnell. Facebook post suggests several KRMC nurses have been getting inoculated. Is that true? And if so, how many staffers so far?
So if we're using the term inoculated as in receiving the vaccine, we have received no vaccine to date.
All right. Follow up here. Please note how your staff has been at risk and how heartily they embrace vaccine for personal and family safety. This comes from Dave Hawkins.
So the notion of taking the vaccine is a very personal decision. We are following the same criteria as others with 1A, 1B, and how it's administered, but we are not making the vaccine mandatory. It is still a choice. Now, if you choose not to take the vaccine and you're in the 1A category, you would then move to the back of the line. And we're doing that so that people feel like they can actively opt in. And that's how we're choosing to handle that side of the vaccine administration.
All right. Here's another one. This is for Valley View Hospital. When will they hire a, I'm sorry about the pronunciation here, pulmonologist, is that correct? To assist the COVID patients?
Currently, our physicians that are providing the care in the facility have the ability to care for patients. We currently have COVID patients in the hospital that are being handled. Pulmonology is a higher level care, and for that service, we reach out to other facilities to assist us. But currently, all patients that are in the hospital now with COVID are being treated appropriately and are being taken care of appropriately by those individuals that are on our medical staff that are qualified to vent patients, be able to handle all the BiPAPs and other breathing apparatus and devices needed to care for those patients accordingly.
All right. It looks like we're getting the Moderna vaccine. Is there any reason that either the Moderna or the Pfizer is better than the other? Or is it both of them are pretty equal and we're fortunate to get one or the other right away?
I believe they're very equal in their capabilities and in their ability to fight the virus or to create that immune response for the virus.
Any of our CEOs want to answer that?
Yeah, the studies have shown that they're very equal as far as the how many people it protects. I believe they're both around 95%. And then from our perspective at the hospital, the Moderna is actually easier to handle because it doesn't require the deep freeze, and it's a little bit more stable for a longer period of time outside of the freezer. So from that perspective, it's actually much better for us to administer the Moderna than it would be the Pfizer. We could do either one, but Moderna is a little bit easier, so we're happy about that.
All right. These questions come from the Kingman Miner, and as you might suspect, they are directed to Will McConnell of KRMC. This is the first one, how many coronavirus patients are hospitalized at KRMC? Can you tell us?
Currently, right now, we have 51 COVID positive inpatients, and that is either COVID positive or they are in a position of being a rule out, meaning the test is pending, or they are considered non-infectious, which is based on CDC guidelines that post 21 days of a positive test, you may still test positive, but you're no longer infectious. So in total of those three categories, 51 in-house currently.
All right. What all is entailed by the surge plan implemented at KRMC, and when was it put into place?
So the surge plan has been in place in one form or another since it was initially created in the beginning. How it gets implemented and administered is very situational. And so a lot of times what we'll do is when we come in the morning and we're looking at the number of discharges that happened yesterday and the number that are planned for today, the number of admissions that have come in overnight, we'll look at the staffing and we'll look at our capability and make decisions sometimes hour by hour. It just depends on the flow. And again, it's more about staff than it is about space. And so we have calls out to nurses who have transitioned from a floor role to an outpatient clinic or to another area of the organization, and we're in the process of working with them on redeployment so that we can shore up some of those inpatient floor positions that are critical for us to really keep that flow going through the hospital itself.
One other question for the time being. How many staff members at KRMC have contacted COVID, and is it having an impact on operations?
So to date this month, we have had 96 staff members come down with COVID. 21 of those in the past week are bedside staff. And so that is impacting operations to the extent that we're implementing the aspect of the surge plan that pulls staff from other areas of the organization. So we're in the process of looking at how can we run kind of a skeleton crew in an outpatient setting so that we can really use those resources on the inpatient side?
All right. We know that these questions came from the Kingman Daily Miner, and of course, they're most interested in the responses from KRMC. However, this is going out to everyone and other areas as well. Would you like to respond in any other ways regarding those questions to your own situation at your hospitals? Any of you want to chime
Sure.
in? Yes.
At Western Arizona Regional Medical Center, we've had approximately 40 or 50 employees that have tested positive. We've only had 2 actually be hospitalized, however. But anybody that's been tested positive or was in contact with somebody that did test positive are required to self-isolate or quarantine, as the case may be, if they're tested positive. Just another comment. The clinical efficacy of the 2 Moderna and Pfizer vaccines are both relatively equivalent. However, people are advised not to get vaccinated with both. It's one or the other, not both. There are implications to doing that.
Yeah, that's what they say is if you get the first one as Moderna, then when you get the second shot 4 weeks later, it needs to be Moderna again. You don't want to mix and match those. But the situation at Havasu sounds very similar to Kingman as well. We've been averaging, since Thanksgiving, or about a week after Thanksgiving, we've been averaging between 45 and 55 COVID patients in-house at any given time. And we are seeing that they are getting better a little bit more quickly, and we're getting them out a little bit more quickly than back in March or back in July, I guess, when the big spike hit us. And fewer of those patients are going on vents, although now we're utilizing BiPAP machines and vapotherm machines to give these patients high-flow oxygen, which tends to be helping them a little bit better. So that's been positive. Staff, same situation. I don't have the exact numbers, but we've probably been in that 75 to 90 range of staff that have contracted COVID. And we have a few staff out every day, and it has ramped up a little bit more over the last week and a half.
All right. Sir, from Valley View Medical Center?
Currently in Valley View, we have 13 COVID patients in-house, and we have 4 additional patients that are persons of interest. They are admitted, and we are waiting for their lab results to come back to determine if they are COVID positive. Again, we are continuing to see an influx of patients in our emergency department that is coming in daily. And so, like everyone else, we're treating and taking care of those patients on an hour-to-hour or day-by-day case as we see those patients hit the door. For our facility, in the last 2 months, we have seen 11 of our staff members who have contracted COVID. And again, those individuals have isolated and have gone home and have gone through their treatments at home. And most of those have returned back to work. At present, we have 3 that are out that are COVID positive. But again, no one has been hospitalized, and we are keeping a close eye on watching those individuals and offering any support they may need as well.
I have a general question here for any of you to answer. Is the COVID-19 situation at this particular time, is it better or worse than you expected?
So I'll start. The answer is yes. and let me elaborate. It's better than expected because of some of the things that Mike mentioned. Our ability to treat COVID has improved over time. We've learned more. When a patient comes into the ER and they're not feeling well and they may be dehydrated, pushing fluids is one of the first things that's done. With COVID, that's not the best initial treatment. Reducing the likelihood of putting someone on a vent because of how hard it is to get someone off a vent and utilizing other treatments. Those are things that it's better than it was because we know more about it. I am surprised that our rolling 30-day percent positive is above 24%. That's the surprise.
All right, anyone else want to anything? All right, we have a question for Denise. covering this COVID-19 issue over these months, what has been the most stressful about it, and how did you deal with it?
I think the changing dynamics of the virus and our response, initially we had very few cases, and then that number increased dramatically. So finding the resources to complete investigations, contact tracing, and follow-up were challenging to do that in a timely manner. And then responding to the vaccine and knowing that we were going to get that into our facilities, and the logistics and the challenges of that have all been very challenging. I think overall, though, it's really just trying to get that messaging out of how important it is to take all of these precautionary measures and the seriousness of this illness, and trying to convey that in a way that doesn't create panic and fear, but definitely generates a response so that people understand how they can impact hospital capacity and the health of our community.
Would it be helpful if a statewide mask mandate or local mandates were put into place? Anyone?
So I prefer, obviously, that people do that in a willing manner and as a commitment to their community, that this is how we keep our friends, our family, our neighbors, the residents, even if you don't know those individuals of our community, safe. I understand people's reluctance to go down the road of a mask mandate, but I also see how it did help in each of these communities that chose to go that direction. When you look at our epi curve, it is very hard to say that that was not effective in those months when our case counts were down after the summer and moving into fall.
All right. Do you have any recommendations? It could be from you, Denise, or one of the CEOs as well, regarding Christmas travel or gatherings?
We are recommending to follow the CDC guidelines. You stay with the family you don't invite other people over. Stay within those very nuclear circles and stay close there. It's really important. The hospitals are under a lot of demand at the moment, and I think to assist them and to assist our community and keep this curve down, we've got to really take those steps. And it's a challenge. We recognize it's the holidays. This is when families get together, friends get together, and they celebrate. But we're so close with the vaccine. We just need 4, 5, 6 more months to get through so we can get this vaccine out to the community and really get back to that new normal. And moving forward, look forward to next Christmas as a celebratory time.
Or start January 2021 a little bit later, maybe. Mm-hmm. All right. Would you have another question from the Herald? Michael Zog there.
Yes. Could you tell me how vaccinations will be scheduled? If you're, say, in the 1B population, will you be notified, and who will notify you? How do you work that out?
So in the hospital, we have a plan. So for giving the vaccine, we have identified all of the individuals who would be eligible in each group, so 1A, 1B, and so forth. And so we are notifying those individuals and or entities. If it's, a fire department or ambulance service or hospice or home health, we will notify those entities when it becomes their turn. And then we will give them the documents that they will need to fill out so that they can then call and get scheduled. So it will be scheduled, as I said before, and we plan on doing about 100 shots a day. Once we have it and we have it rolling out, we'll be able to do that.
All right. Michael, did you have a follow-up on that? You can if you like.
It's not exactly a follow-up on that, but could you guys talk a little bit about the surge line, what role that's playing right now? Are you sending patients out or accepting patients from other areas?
We are part of the surge line at Havasu Regional Medical Center. I think all of us probably are. And we utilize the surge line every day, you know, whether we can take a patient in or a patient out. That's the beauty of it. You know, if we have a bed and capacity and staff and there's another hospital that has that need, then we have to be open to taking a patient. And we are very happy at times when we don't have the capacity and we are relying on our other fellow hospitals to take some of our patients from our community so that they can be in the right place at the right time and get the treatment that they need.
I have a question from the AP. I got this same question from two others as well. Seems to have, they all have a bit of a familiarity with our county. And the question is, do you anticipate reluctance by the Mohave County public to be vaccinated? And how, if there is a way, how can you overcome that?
Just 2 weeks ago at Wormsey, we took a poll of our employees to get an idea of how many vaccines we would need once the vaccination is approved by the FDA and the CDC. And roughly a third volunteered to take the vaccine immediately. Another third said they were going to take a wait and see, and the other third said they weren't going to. So I don't know if that reflects on the broader community or if that's just our organization. But obviously, as the vaccination program rolls out across the country, I think you're going to see more and more people. If there aren't any major issues with allergic reactions or subsequent illness, I think you'll see a lot more people step up to the front of the line and want to be vaccinated. They just are afraid at this point that the vaccine, we just don't know at this point. We believe it's going to be effective. We believe it's not going to be a problem. But until we actually get through it, we won't know for sure. So that's our perspective.
All right.
To add to that, the notion of fear around COVID is 100% true. If you look at media coverage of the vaccine, if you look at media coverage of COVID itself, it seems like from the beginning until now, in order to draw eyes, the underlying communication style is more and more fear-based, and that's what's pulling eyes to news articles, etc. As we roll the vaccine out, and as people see the effect of the vaccine as positive, I think it's just going to be a normal change curve. You know, you have the early adopters, you have the majority, you have the late adopters, and then you have the ones that are never going to get on board. And working together with public health, working together with the other CEOs on that education component is going to be an important aspect for our community, so that fear starts to come down. And it's the same way, the closer you are to someone who has had COVID and gone through it fine, the less fear you have about COVID itself. The closer you are to someone who has gone through COVID and has had a severe reaction and has died, you have that perspective of the reality of COVID. The more we kind of fill in the middle, I think the more comfortable the population is going to be. And at some point in the future, the COVID vaccine is going to be a lot like the flu vaccine. We're just too early in the process, and there's still too much unknown. And so until we kind of reach that saturation point with COVID, it's going to continue to have this fear-based halo effect, but it will approach the flu from a treatment perspective as more and more people understand how things will progress.
Anyone want to add anything to that? All right. I've gotten a number of texts here, but would we have anybody online who has not asked a question yet? A reporter online.
Yes. Can you hear me?
Hello?
Yeah, this is Cameron Poland from ABC 15. I was wondering how many community health partners have been approved to distribute the vaccine in Mohave?
We may have to ask you to repeat that. For some reason, the volume on it wasn't sufficient. One more time, please.
Yeah, this is Cameron Poland from ABC 15. Today, I'd like to know how many community health partners have been approved to distribute the vaccine in Mohave County.
Our health director, Denise Burley, is going to answer that, I believe.
Certainly, yes. And I need to look at my list here. I believe we're sitting at about 16 facilities that have completed the onboarding process and received approval from ADHS and are now active in the system. That's an approximation. I don't have the exact list in front of me. I do remember receiving an updated list just in the last day or so.
You have any other questions, Cameron?
Not at this time. Thank you.
All right, you're welcome. I know that Paul Lavoie, you had another question or two. Go ahead.
Yes, this is a follow-up to those people who don't want the vaccine, and I've run into several of them and have had them comment to me. Is the county health department prepared to lead a public education campaign regarding that?
Yes, and I think it's very important that we take steps to inform the public of the importance of this vaccine
Has left the conference.
and how it can contribute to our overall county health. I know that we've started taking steps to put together frequently asked questions and other documents to support those efforts, and you will be seeing more of that on our county website in the near future. And we'll be sharing that with other agencies.
All right, we got a little interruption there from somebody joining or leaving, one of the two, not sure. Go ahead, Paul, you had another question?
Yeah, I had a listener ask, how long does the shot last? Is this a lifetime vaccine or something that's going to need a booster?
So I don't know that we know the longevity of this vaccine at this point. I think that is part of the research of this particular vaccine, and we'll continue to learn more about it. And hopefully, and we know that there are other vaccines sort of in the research tunnel at the moment that are also in development that may have a longer lasting effect than this one as well. These two.
In my understanding from speaking with several physicians at KRMC is it also depends on what we learn from COVID over the next several months. Is it more of measles, chickenpox from a vaccine perspective, or is it more like the flu vaccine that changes annually? Many vaccines are stable because what they're affecting is more stable. It's still unclear what's going to happen from a COVID perspective if it mirrors the flu, which means annually there's going to be some change to that vaccine or not.
All right, anyone else up there want to say anything? This question, this is a minor question, M-I-N-E-R, daily minor. It's a major question from a minor, all right? What percentage of local residents need to get vaccinated to stop local community transmission of the virus?
I believe we're looking at least 70% of the population being vaccinated to reach that real baseline of herd immunity. I mean, ideally, for most vaccines, we would be up around the 95% level. But in this particular case, I think we're really striving to reach that 70% level.
All right. Do we have any other questions out there from any of our participants online?
Yeah, Roger, I have a question for the CEOs.
Go ahead.
Paul Lavoie from Radio Central. HIPAA requires certain personal information be kept from the public. Do hospitals go beyond that and keep more information private than is required by law?
Did we get that question okay? Repeat it one more time, please.
Yeah, I'm having a hard time hearing myself on the phone.
Technology.
HIPAA requires certain personal information be kept from the public? Do hospitals go beyond that and keep more information private than is required by law?
One of the CEOs?
Yeah, this is Mike Patterson. The law requires us really to keep all health information private unless we're required by law to reveal that. So, everything will be kept private other than what we are required to report back to the CDC or federal government, which there are requirements with this vaccine for reporting back to them.
All right. I believe that's it. Let me just make certain here. Anyone else online?
Yeah, I have one more question, Roger.
Okay, Paul.
Sorry. If I could get Denise on speak out, I wouldn't need to ask all these questions. Is the county recommending people wear masks even after getting both doses of the vaccine?
Yes, we will continue to ask and recommend that people wear masks because we will not reach that herd immunity, and we want to continue to encourage people to protect those around them.
And that was a good final question. Thank you very much, Paul. We're going to turn to our 4 COs first, and then with the final comment from Denise Burley. Each of you, some type of any closing comments that you would like to make, and we'll go in the order that we began, if that is all right. So we'll start right off from the beginning with Western Arizona Regional Medical Center's Mike Stinger. Mike.
Very simply, wash, mask, distance, vaccinate, and stay safe.
All right, we turn next to Will McConnell, CEO with the Kingman Regional Medical Center.
Can't thank our staff enough for the sacrifice and the work that they're putting in. We know it's a lot and we appreciate it. I want to speak just briefly to visitation. We have taken the position that we will never go back to 0 visitation in the hospital, and that's partly because when you look at the effect of no visitation in the delivery of healthcare, it's essentially removing one leg of the stool. So if it's a 3-legged stool, you have the health system itself, you have the individual receiving care, and you have their support system. When that support system is removed from the equation, it has a negative effect on the experience, but also the care, especially when you have a loved one in the ICU, where communication is almost impossible with that individual if they're sedated, if they're on a ventilator. So we've tried very hard to structure the visitation environment to allow for that, because we feel it's critically important. If you look at some of the data coming out about our loved ones in long-term care facilities that are locked down with 0 visitation, the psychological effect that that is having on that population is profound. And so part of this is just a call out to remember the humanness that we all need to have during a time where we're asking people to distance.
Thank you. Havasu Regional Medical Center's CEO, Mike Patterson.
Yeah, so I echo Michael and Will there on their comments, and just want to thank everybody for really doing the right thing during this time, and doing all we can. I know a lot of people in the community might not see it as much as we do, being in the hospital, every day, and from a community perspective, COVID might not seem as big as it is, but from the healthcare perspective, it truly is a big deal right now, and we all need to be doing our part to do all we can to prevent it, and that includes getting the vaccine, which I just got a text saying that we just got ours, so hopefully that's going to be the news for everybody soon. So more to come. Stay tuned and be ready for it. Thank you.
Very good. Just got a text just now. Very good. All right. From Valley View Medical Center, the CEO, Feliciano Huron. Yes, sir.
Again, we want to thank our hospital team, our employees, and our physicians for all the wonderful work that they're doing every day to help us care for our patients. Again, I ask that the public please go out and and take care of yourself. Make sure that you're hand washing, you're masking, you're sanitizing, and then more importantly, as you're caring for those people around you, your family members, please make sure you're watching that social distancing. And I know we're going into the holidays, and it's important for us to also continue to keep up the pace that we're doing right now with helping to care for one another, and make sure that we're doing the best that we can as a community to socially distance, and try to find different ways to help celebrate those meaningful times. Read an article that said it's important for people to talk and FaceTime right now. Maybe that may be some options for folks to reach out to their loved ones and to those individuals who are also out there who may be at home quarantining or alone. It's a great way to reach out to them because that support from the community and from their loved ones is also helpful.
Thank you. And Denise Burley, Mohave County Health Director.
Thank you. I want to thank my staff and county staff and all of our community partners for contributing to this response. We have to solve these problems as a community, and all of our partners are very important in that role. Public Health has worked diligently to stay on top of all of the evolving developments around the COVID virus, and they have done a tremendous job and under very new and uncertain circumstances. So I'm very thankful for them and for all of our partners in the community that have contributed to the success of our department. And I really just want to wish everyone a safe and happy holiday moving forward. And we're looking forward to a better new year.
All right, let's all hope for that. Thank you very, very much, all of you, for participating, our public as well as who've been listening or watching. And we will have this online on YouTube for the remainder of today and through the weekend. Thank you.